Well, I'm Tori Vallon. I'm a women's integrative nutrition and lifestyle coach. I'm also a functional weight loss specialist. I'm a hormones educator. And tell me, do you struggle with joint pain? Feel free to mention to me which joints you struggle with. I would love to know. While we're waiting for people to jump on the call, you've probably heard about my incredible signature program. It's called the Radiant Health Reset. It's the program that gets all those amazing results that you see all over my Facebook page and my profile. We had Louise who came to us and was able to relieve herself of all of the symptoms of rheumatoid arthritis just in the first few weeks of the program. Jane is here. Oh my goodness, Jane, it's lovely to see you. Jane's been following along for a little while now. Beautiful to have you here. Yeah, so Louise was able to get relief from her rheumatoid arthritis symptoms within just the first few weeks of our program, which was very exciting. Previous to that, she was using immunosuppressing drugs and was able to step away from all of that. And it happened all so quickly. She was, as you can imagine, delighted. It's life-changing for her. She leads a very active life now, whereas she was unable to before. We had Fiona, who joined the program and said, oh my gosh, all of my menopause symptoms have reduced significantly. The brain fog's lifted, but importantly, I have far less joint pain. That was really exciting for her. We had Linda who came to us who started with a joint pain score of severe. By the end of the program, she had a joint pain score of 0. There was no joint pain left. We had Renee, yeah, Jane knees. Yes, absolutely, really common one. We had Renee who came to our program. She was getting multiple massages every week for the amount of pain she had in her body. After a few weeks, she was like, oh my goodness, I don't need to get massages for pain anymore. She could continue to get relaxation massages because that's really nice, but she didn't need them at such frequent intervals because she was no longer using them as a crutch to get through the week. She was able to use them as a source of relaxation. That was really exciting to have that for Renee, for her body pain just to go away. Amazing. And then recently, you would have seen just over the weekend on my Facebook profile, we had Sarah who came to our program with weekly migraines, with vomiting. Within just 2 weeks, she's now going into week 12, but within the first 2 weeks, her migraines disappeared after years and years of debilitating migraines and trying absolutely everything. You can just imagine how life-changing that was for her as well. We've got Jenny in the program whose belly fat is melting away. She might even pop on because she often joins us here on Tuesdays as well. So if you've just joined us, please say hi. I was just talking about the Radiant Health Reset, the extraordinary life-changing results we get with women in that program. But today's topic is joint pain in menopause, the inflammation connection that nobody talks about. You know, getting into menopause, you know, women will notice, oh, it's just not as easy as I stand up off my chair, kind of like catch yourself having a bit of a groan, or waking up first thing in the morning and finding that hands are so stiff, it's even a bit tricky just to sort of grip your mug or cup in the normal way. Or you might feel like James pointed out, knees, just kind of aching, struggling, hips, shoulders, thumb joints, you know, just starting to ache for no reason that you can really point to. So this training is for you so that you can start to understand a little bit more, because you've probably been told that this is just menopause and this is just your age. But by the end of today, I want you to understand that there's a lot you can do about it. There's a lot that's within your control. You can start to understand what's actually driving that pain. It's far more fixable than anyone has ever helped you understand before. So that's what I'm here for. Let's go. So first thing I want to talk about is why joint pain is not just wear and tear on the joint. Because that's what we are largely led to believe, is that we get wear and tear on our joints as part of getting older. It's just, you know, people say, well, it's just a bit of arthritis, so take an anti-inflammatory, move on. There's really nothing you can do about it. Just lose some weight. It'll take the pressure off the joints. This is the advice that we're largely given out there. But I feel like we could do a lot better to serve our women. I think we could help women see that there are specific things that are driving this joint pain. And if we can just start to understand the drivers, then we can, underneath the drivers, we can find the root causes of the problems. very often the root causes can be fixed so we can relieve ourselves of the pain. So that's what I'm talking about today, effectively. If we just label something arthritis, well, really all we've done is given it a name. Arthritis. So itis just means inflammation. And arth, it comes from the Greek word arthron, and that just means joint. So arthritis is literally just means joint inflammation, and it doesn't tell us anything at all about how this person came to have inflammation in their joints, much less how we can fix it. And so a label alone is not as helpful as what people believe that it is. If there's inflammation in the joint, you could call it arthritis. Anyone can do that. A doctor can do that. You can diagnose yourself. But what we really want to know is what's causing it and what can I do about it? That's what I'm passionate about. The problem with just labeling something arthritis as well is that it makes us think the joint itself is the sole problem here. Yeah? Has anyone ever thought that? Oh, my knees are probably the problem. I'm keen to know from you, Jane. My knees are probably the problem. Or, if we feel it in the thumb joints, oh, my thumbs are probably the problem. That something structurally there is just worn out, and then we're just on this kind of one-way track for it just getting worse and worse and worse. But what I want women to understand that probably hasn't been explained to them before, that joint pain that appears in menopause, or let's say suddenly becomes much worse in menopause, in the menopausal transition, is inflammatory. Stay with me because we'll keep unpacking this until it's really clear. Is inflammatory. Inflammatory joint pain has specific drivers. And this is not the same thing as having joint pain as a result of mechanical wear and tear, because mechanical wear and tear doesn't show up in clusters of joints and multiple joints as soon as you get into your 40s and 50s and 60s. It would show up in one joint that might have been subject to an injury. There may have been trauma in that joint. But if you wake up in the morning and it's in every finger, does that sort of get you thinking, yes, well, Jane, actually, there's a little more to it. So Jane said, yep, weight or back is the problem. Yep, you've been told that. Absolutely. That's what we largely get told. And so what I want to do is break it down so you understand that there's a little more to it than that. Yes, it's a factor, but there are actually far more important factors we need to take care of. So what I feel like we're not being told is that when it's appearing in clusters of joints, when it's appearing in whole body sections and systems, multiple joints, then that's our body talking to us and saying, we have a systemic problem here. There's not a local structural problem alone. If we use the fingers example, that would show up in one finger or two fingers. Maybe I had a netball injury decades ago. If it's showing up in all of my finger joints, so that's systemic. And that's the body talking to us. Hey, I need some help. I'm showing up everywhere now in a big cluster. So that's quite empowering, actually, because although the joints are the location of the symptom, they're not the source of the problem. And that is a really important thing to understand, don't you think? Yeah? The symptom shows up in a particular location, but that location is not the source of the problem. Just give me a thumbs up if you're following along so far, if that makes sense to you. The joint is the location of the symptom, but it's not the source of the problem. That's a really important thing to understand. Because if the joints were really, really worn out, they wouldn't actually be wearing out in every finger at the same time. And it would also mean that there's very little that we can do about it. But if the joint is simply where a systemic problem is showing itself, well, that's great news, because that means we can start to address the problem and the symptoms will start to resolve as a result of that. And that's the whole theme of what I'm talking to you about today. The pain is where you feel it, but it's not where the problem started. Okay? All right. Give me a little bit of feedback. Give me a thumbs up. Give me a little heart. If you are following along, if this is making sense to you, great. Thanks for that. I'm getting a thumbs up in the comments. All right. So now I want to talk about the estrogen connection that is not really being explained to women. So what women are not being told that we ought to start telling women is that estrogen, earlier in our lives, estrogen was doing far more for our joints than anyone ever helped us see. It works very quietly in the background and it buffers us from joint problems. It buffers us from inflammation showing up in joints. And then, you know the old saying, you never miss your water till you're dry. Yeah, well, that's estrogen. We know about it when we don't have much left anymore. So in simple terms, here's what's happening biochemically in your body. Estrogen has a directly anti-inflammatory effect on our joints, on the joint tissue. And estrogen is helping maintain synovial fluid in the joints, which is lubricating the joints and making them move well. And that feels nice when there's lubrication there and things can move well and they're not so stiff. And estrogen's doing a whole lot actually earlier in our lives. It's also supporting collagen integrity for tendons and ligaments and cartilage that all rely on collagen being supplied to them. So I could keep going, but my point here is that estrogen was built-in joint protection, a built-in joint protection system. And then we transition to a different stage of life. And then when estrogen declines, we often talk about this inside Radiant Health Reset, but I talk about this a lot in my live trainings as well. Estrogen declines, we find ourselves in menopause, we have very little estrogen left, if any at all. So the protective buffer we had has declined along with the dropping of our reproductive hormones. And so the joints are not so lubricated anymore. And so the connective tissue in our joints is not as resilient anymore. And that tissue is becoming more vulnerable to inflammation and the damage that results from inflammation. When estrogen has fallen away, it can feel like joint pain just suddenly appears overnight in multiple locations, in multiple sites. And we can feel a bit like, holy heck, this body of mine feels quite broken and old right now. But the main change is that we lost our buffer. I don't have enough time to explain today why this is actually one of the greatest gifts you could ever be given. But briefly, when our reproductive hormones decline, what they do is they reveal the dysfunction that was already there. And it's a gift because it's an opportunity for you to start making different choices in your life. Because if you kept living the way you were living, you will shorten your life. But if you make changes, you can live a very long, very healthy life. And so that protection you had before, that was protecting the joints, it's been switched off. But it's good news in a few ways. It's good news in the way that it means your cartilage isn't necessarily deteriorating rapidly or crumbling away. It's just a loss of protection from a particular biochemical support we had in place. And that buffer being removed is a different problem to solve. Because when it reveals dysfunction to us, then we get the opportunity to think, all right, maybe there's an inflammatory load in my body I didn't notice before, but now I get an opportunity to address it. Yeah, Jane's saying it makes so much sense. You've definitely felt that in the past. Good, I'm so glad this is making sense. Okay, if you've just joined us, please say hello. We've got a few people watching. So please say hi, let me know where you're from and tell me, do you get pain in your joints? Does it appear in clusters for you? Because it could be what I'm talking about today, where joint pain that shows itself in menopause is connected to systemic inflammation, which we can change, which we can modulate. You can lower the inflammatory load on your body that the estrogen was trying to manage for you. So even though we don't have estrogen managing anymore, it's okay. We can still do something about it. And you can support your joint tissue with the raw materials that it needs, the nutrients that it needs. So your body's not turning on you and it's not, just deteriorating rapidly and there's no way back from here. Estrogen was a tool that your body used to rely on quite heavily. There are other tools we can hand it. Now, this is not a discussion today about HRT, but we do have that discussion in various places. Sometimes during my challenges, we talk about it in my Radiant Health community. We talk about it inside this group. It's not part of the discussion today because today we're using the decline of our reproductive hormones as an opportunity to look at our diet and lifestyle choices. Okay? Our body was relying on estrogen. It can't rely on estrogen anymore. Can't rely on systemic estrogen anymore. And so got a great opportunity to look at the levers, what was going on underneath that estrogen was protecting us from. So again, just a reminder, if you just joined us, the joint that you feel the pain and the stiffness in is the location of the symptom, but it's not where the problem started. It's not where the problem started. So let's talk about what's actually feeding the inflammation in our bodies. I want to be really clear about something. Joint pain that suddenly appears in menopause, in multiple sites, multiple locations, in clusters, like not just one finger, but all of your knuckles, for example. Like not just one knee, but both. Not just one hip, but both, right? When it appears like that, then, and it appears in menopause and it was not really there before, then inflammation, right? We can all agree inflammation is contributing, but inflammation is the mechanism. It's not the root cause because something's causing the inflammation, right? And inflammation doesn't just happen for no reason. There's always a reason. There is something feeding the inflammation. And that's what we want to find out. What's feeding the inflammation? So I'm going to give you some ideas. So what is it? What's creating the inflammation in your body? If you think you know, you can go right ahead and type it in the chat right now. But I'm going to throw some ideas at you of things that are likely to be kind of pouring the gasoline on the fire. Number one is what we call enhanced intestinal permeability, also known as your leaky gut. You probably got one. If you've got joint pain, you've probably got leaky gut. What we mean when we talk about leaky gut is when the lining of the small intestine is compromised. It's supposed to be a little bit permeable. It's not supposed to have gaping holes, right? I'll talk a bit more about that in a sec. What else is contributing to systemic inflammation? Well, blood sugar dysregulation. Every time you have a big glucose spike, you also get a big inflammatory cascade happening in the body. Yes, good one, Jane. Jane's saying nutrition. Exactly. Exactly. So Jane named nutrition as probably one of the things that's contributing to inflammation. Correct. Dietary inputs. Maybe your diet has lots of seed oils in it. That's going to create a lot of inflammation. Maybe your diet has too many refined carbohydrates in it. That's going to create inflammation. Maybe you use alcohol through the week. That's going to create inflammation. Correct, Jane. Well done. Anyone else want to throw some ideas in the ring? I know we've got a few people watching the call today, so please feel free to throw your ideas in the ring. What else do you think is contributing to the systemic inflammation that's causing your joint pain in menopause? I'll give you a big one because I've worked with thousands of women. Thousands of women. Elevated cortisol, anyone? Do women get stressed? No. No. Hang on, what? I think they do. I think they do. And plus, if you're in menopause, then you lost your progesterone a long time ago. That was keeping you calm. And then it's even harder to manage our cortisol rhythms, appropriate, healthy cortisol rhythms. So chronically elevated cortisol is pro-inflammatory over time. It's all right to get stressed for a moment, but if you're stressed every day, day in, day out, that's a pro-inflammatory state. Another one that doesn't get talked about very much, and this one, I don't want to confuse you guys, but estrogen clearance is a problem here too. And I know we talk about estrogen being rock bottom in menopause, true, but adipose tissue, which is the fat stores on our body, are producing estrogen. An excess of estrogen, not necessarily the right type of estrogen that actually helps us and feels good, and the body needs to clear it. We end up with an excess of used estrogen metabolites, which continue to recirculate. They continue to plug into our receptor sites on our cells, and they, instead of just leaving the body as they should, they're actually adding to the inflammatory load, and they're creating even more excess weight on our body. It's quite a problem, right? And they're causing inflammation too. So poor estrogen clearance is part of this picture as well. Yeah, so Jane said gut health. Good. So the first thing I mentioned was enhanced intestinal permeability, also known as leaky gut. Let's break this down, seeing as Jane mentioned it in the comments too. Because a lot of practitioners aren't talking about this one, and I really think we need to. When the lining of the small intestine becomes permeable beyond what is healthy for us, right? I mentioned that our small intestine should be somewhat permeable. We want nutrients to pass through. We eat nutrients, they end up in the small intestine, broken down very, 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 very small into their molecule level, and they should be able to pass through the lining of the small intestine. So we call that selective permeability. A nutrient should be able, something the size of a nutrient, micronutrient, should be able to pass through. What we shouldn't have is holes that are big enough for anything larger than a micronutrient to pass through, but that is unfortunately what we have in most cases. And so when the holes are bigger, then bacteria can pass through as well. Toxins can pass through. Little pieces of your undigested food can pass through. That's not good, because just on the other side of the small intestinal wall is what we call the GALT, the gut-associated lymphatic tissue. Most of our immune system lives there, and it's hypervigilant to things passing through that gut wall. If a little bit of food passes through the gut-associated lymphatic system, the immune system that's waiting there to see what comes through is like, guys, it could be a bit of avocado, it could be a walnut, who knows what it is. Guys, don't know what this is. It's definitely not supposed to be here in the lymph. So I think what we ought to do is tag it with an antibody, and if we ever see it again, get really mad, flare up, get inflamed, because this body is under threat, and under threat inflammation is a good thing. And so that little piece of food that passed through, chances are it's something you eat all the time, and chances are that food's going to pass through again. Next time it's like, right, attack. And then that food is passing through undigested again and again and again. And what do we get from that? We get systemic inflammation. Now, why does this affect your joints? Because your joints are highly vascularized. They have blood flow going to them, which is good. We want plenty of blood being supplied to our joints. Lots of nutrients can be delivered there. I talked about some raw materials we need to keep those joints good. Collagen, for example, amino acids. But if blood is getting rushed there all the time, then what else is traveling through the blood? Well, the inflammatory cytokines. So this, or let's say this, or this knuckle becomes a primary site where systemic inflammation is going to settle and stay. It becomes a site of delivery for the inflammation. So, Jane, 10 points for Jane, 10 out of 10. The gut connection is well established in autoimmune conditions like rheumatoid arthritis. How did Louise come to my program and get well? Well, we did a lot of things, but one of the things is we helped her heal her gut. So even if you're just experiencing general joint pain and you don't have an autoimmune diagnosis yet, the same driver exists, the same gut-driven inflammation exists. It's just subclinical, by which I mean it hasn't been diagnosed yet. But you're experiencing the generalized effects of it. Yeah? We've got a few people on the call, but only Jane's joining in today. If you just got here, please say hello in the comments. I would love to know, do you experience joint pain? Where do you experience it? Is this making sense? If you like this information I'm offering today, give me a thumbs up, give me a little heart emoji, and say it with me. The joint is the location of the symptom, but it's not the source of the problem. All right, let's say it again. The joint is the location of the symptom, but it's not the source of the problem. Okay? So you don't even have to directly treat the joints at all. You might for rapid relief of your symptoms. That just gives you symptom relief. Hey, Michelle's here. Hi, thanks for saying hi, Michelle. So you can get some rapid relief if you treat the joint, but you're not going to solve the problem because the problem's not coming from the joint. All right, so what actually moves the needle on the problem? How do we get some traction here? What actually works? Well, don't mask the pain all the time because very often the things we're using to mask the pain are contributing to the leaky gut, like non-steroidal anti-inflammatory drugs like ibuprofen. So we don't want to keep doing that anymore. So first what we want to do is we want to remove the systemic inflammatory load on the body, right? So that means fix your leaky gut. That means stabilize your blood sugars. And that means clean up your diet. Stop feeding the fire. And we want to support estrogen clearance. Yeah. So if there's excess adipose tissue on your body, if you're carrying excess fatty stools, we need to manage that. We have to work at that, work at those levers. And that's a conversation for another day on how we do that. In Radiant Health Reset, we do it all at once. And you don't even feel like you're doing any work because you just follow a plan. You just go bump, ba bump, ba bump, follow the bouncing ball. We have to do the liver and the gut work to work on the estrogen clearance so that we don't have estrogen metabolites recirculating in the body causing problems. And we've got to give the body the raw materials that it's missing, because there are minerals, there are nutrients, there are fatty acids that are frequently missing in women who are struggling with joint pain in menopause. And we don't just give you a generic supplement plan, by the way. We do most of this with food. We do use supplements strategically, but believe me, it's a very, very, very small list. If you are just using supplements to address the problem, that's no better than going out and getting a pharmaceutical drug a lot of the time. You just swapped one for the other. You're not going to solve the root cause of the problem. Okay? So, do you guys see? Yes. Hi, Sally. I'm just reading your comment. Yeah, and it's worse when you're eating your crappiest. Aha, there you go. Okay. Well, I'm happy to hear you don't get a lot of joint pain, but interesting that it does show up when your diet is the worst. Makes sense, right? All right, so to summarize, if you've got joint pain showing up in menopause, what I said earlier in today's session, if you missed it, If it appears in menopause and it's affecting multiple joints, then it's not cartilage wearing out, is it? Right? And it's not inevitable. It's caused by systemic inflammation. So it's showing up in your joints, but your joints aren't the problem. Why is it showing up in menopause? Because previously in our lives, estrogen was buffering the problem. It was letting you get away with your diet and lifestyle choices. And then now estrogen doesn't buffer that for us anymore because estrogen left. The pain's in your joints, but the problem's not in your joints. And that is probably the best news that anyone ever gave you. Because now, if you just address the inflammatory drivers and you support good foundations for your body, then the joints that ached for years and years and years are going to respond very quickly. And that is exactly what we do inside Radiant Health Reset. It's where we work on the gut and we stabilize the blood sugar and we work on hormone clearance and we get the foundations in place and we do it in a very clear, supported way, step by step. Now, the doors to the Radiant Health Reset are closed at the moment, so you can't get in. We don't have any open places. But if you would like to be on the wait list, then I want you to comment in big capital letters, wait list, so I can't miss your comment and we can send you the information and talk to you about getting you on the wait list and then letting you know when doors open again. So, thank you so much for joining me today. I deeply hope that this was useful information to you. And I look forward to seeing you next week for another interesting, deep, rich topic where we can nerd out on matters affecting women's health. Thank you again for wanting to do better by your body and joining us here to educate yourself some more. I hope you have an amazing day and I will see you all very soon. Bye now.